Now you know a lot about diabetes mellitus, but you don't know everything yet, right? We left off here, so remember that you need to understand what diabetes mellitus, the disorder, actually is. It's an endocrine disorder. And a while ago, I told you that endocrine disorders could happen because of too much of a hormone or too much activation of a receptor. We're not going to go into details about that second one. Or in the case of sugar diabetes, not enough hormone, type 1 diabetes, or something interfering with the activation of the receptor. And you know now why insulin is important for cells. If insulin is around and if the insulin receptor is working, then when there's lots of sugar in the bloodstream, it'll cause the release of insulin. Insulin will talk to this receptor. This receptor will cause this cell by second messengers to put glucose transport proteins up into the cell membrane. And glucose transport proteins allow glucose to enter the cell by facilitated diffusion. Allow. Remember, facilitated diffusion is passive transport. It's powered by the power of diffusion. It's just that glucose is one of those things that's not allowed to go through the cell membrane. So if it's going to enter or leave, it needs to go through a transport protein. Okay. Now, let's talk a little bit more about the two types of sugar diabetes. Here we see on the left side, these yellow guys, they are insulin receptor proteins. And they're designed to bind to insulin, the hormone. And when that happens, we get all kinds of second messenger stuff. And ultimately, it leads to these glucose transport molecules being put in the membrane. Now, with type 1 diabetes, you have got excellent receptors. Everything there is working fine, but there's not enough insulin. And why is there not enough insulin with type 1 diabetes? Because insulin is made by beta islet cells. And in type 1 diabetes, that's supposed to be a 1, in type 1 diabetes, the beta islet cells are being destroyed by that patient's own immune system. And if those cells aren't there, they can't make insulin and you don't have enough insulin. Okay? So that's type 1 diabetes. What about type 2 diabetes? With type 2 diabetes, particularly at the beginning, when someone's pre-diabetic or just recently diagnosed with type 2 diabetes, they actually have got more insulin than they did back when they were still completely healthy. They've got a lot of insulin, and it's not working. And the reason it's not working has something to do with the insulin receptors or the interaction there. And strangely, we have known that detail for decades now, and we still don't know exactly where the glitch is. Keep in mind that I'm saying there's something wrong with the receptor, and so we're all imagining, oh, something's gumming up the receptor. But the truth is, it could be part of all these complicated second messenger pathways. Okay? So, two ways that there can be a problem. Oh, seems like I was supposed to say something there. Don't remember it. Okay. So type 1 diabetes in the United States is actually less common than type 2 diabetes right now. Type 2 diabetes, not just in the United States, but pretty much throughout the world, is at epidemic proportions. And it is a huge burden on the healthcare industry and a huge drag on the economies of different nations. And since it's such a drag on the different economies, the World Health Organization cares a lot about type 2 diabetes. But let's start with type 1 diabetes. It used to be called juvenile onset diabetes. And it is true that it is usually diagnosed before a kid gets to be 12 years of age. I did have one student whose daughter was diagnosed before she was 1 year old. Right? Now, we know it's caused by autoimmune immune destruction of the beta islet cells. Now here it says that it's treated with diet and exercise. Oh, kind of, okay? If a child has got sugar diabetes, type 1 sugar diabetes, then it's true that what they eat, when they eat, how much they eat at each meal, that needs to be kept routine so that the amount of insulin that the child needs at different times during the day can be predictable. Also, the amount of exercise they get, again, should be routine. It should be that on any given day, they're getting a similar amount of exercise. And more exercise tends to be good. However, I want to make this point. Type 1 diabetes cannot be cured this way, okay? Type 1 diabetes is totally different from type 2 diabetes. We'll talk about type 2 diabetes. Type 1 diabetes, we take care of that, but that will not cure the problem. Also, type 1 diabetes, when it happens at kids, it is not because mom ate too much sugar when she was pregnant. It's not because the kid ate too much Halloween candy growing up, all right? Type 1 diabetes is not related to what the child or the mom has eaten during their lifetime. Really important for the treatment of type 1 diabetes, they need regular injections of insulin. Why? They don't have any, okay? So you need to have some. Now, let's talk about type 2 diabetes. I told you that type 2 diabetes is something, it's a lifestyle problem. It's something we're kind of doing to ourselves. And you need to know this term because it's on exam 2. Type 1 diabetes is considered not enough insulin. Type 2 diabetes, when we say something's wrong with the receptor, the way medicine describes that is insulin resistance. It is, there's actually a ton of insulin in their bloodstream and it's not working. So insulin resistance is the failure of the target cells to respond to the presence of all of that hormone. There are 3 main factors in the development of type 2 diabetes. One of those factors is how old you are. Well, not a darn thing you can do about that. It used to be, back when I was young, that no one got diagnosed with type 2 diabetes until they were in their 50s or 60s. And now I have had students that have been diagnosed with type 2 diabetes in their early 20s. So it's true that the older you are, the more likely you are to develop it. If you are 25 years old now and eating like a fool and don't have it, you just don't have it yet. So it's not like you're out of the woods. Be careful. I told you already about heredity, and I told you that really it's not bad genes. They're very good genes. They're just very inconvenient for modern life. And we know that obesity is huge. Now, type 2 diabetes is the kind that actually can be cured, at least in its early stages, by diet and exercise and weight loss. So if you ever watched The Biggest Loser, is that still on TV? Well, if you ever did watch The Biggest Loser, a lot of those people have got type 2 diabetes. And by the time they're on the ranch and they've lost a good amount of weight, they may not need their medications anymore. And that is because there is something about the presence of a large amount of stored triglyceride in our body fat that is causing this insulin resistance. And we really don't know what it is, but we do know that if a person, let's imagine a person is really obese, right? Like they're a good 60 pounds overweight, right? If they will lose even 10 or 15 pounds, that can be enough to cure their type 2 diabetes. So when we say a weight loss program may cure the condition, we don't mean that you need to go all Biggest Loser and get 6-pack abs. Actually, just a moderate amount of weight loss, just to bring you from the obese down into the overweight category, that can be enough to reverse your type 2 diabetes, right? Exercise is also very beneficial. But again, it doesn't have to be the crazy Biggest Loser kind of exercise. You don't have to join CrossFit or whatever. As a matter of fact, just taking a long walk every morning and evening can be enough exercise to reverse this. We know that body fat, just the amount of fat on your body, appears to be almost predictive of who's going to get type 2 diabetes. And we also know that it's the fat that you tuck inside of your abdomen. So humans, we store our body fat in two places. We store it on the outside, just kind of to smooth us all out. If you've got fat on your arms, that's subcutaneous fat, and that is not as, I'm going to use the word dangerous, as the fat that's inside of your abdomen. If you're like me and you're the kind of person that their waist gets big first before their hips and stuff do, then you are more at risk for type 2 diabetes. Now, type 2 diabetes at the beginning gets treated with medications, but I want to make this point because it's on the next exam. Insulin is a hormone and it is made from protein. Since insulin, the hormone, is made from protein, if you were to swallow a pill of insulin, number one, it would not be absorbed into your bloodstream, so it would not have any effect. And number two, your digestive system would treat that pill of insulin just like it would treat the protein in some yogurt you just ate, okay? So we do not have insulin pills. There are no insulin pills. There are some pills, oral medications, that will increase the amount of insulin that a person with type 2 diabetes releases, okay? And there are drugs like Avandia that seem to somehow make there be less insulin resistance. That it somehow, it either makes the receptors that are there more responsive to insulin, or it causes the cell to put more insulin receptors on the cell. Right? But if you've got type 2 diabetes and if you don't take care of yourself, at a certain point, you're going to need to start injecting yourself with insulin. And at the point you need to start injecting yourself to insulin, even if you do lose weight and start exercising, it can be difficult to reverse the disease. Now, I keep saying reverse the disease. You know, it is fascinating to doctors of all kinds the way people respond to being diagnosed with type 2 diabetes. Because I'm going to bet out of those of you who are listening to me, there's a good 20% of you that are like, I'll just take the pills, right? And the reason that I say that is because it's kind of human nature. We want to be able to live the way we want to live. And if we can eat the Oreos, and I had a scoop of Baskin Robbins like an hour ago. If we can do that and just take some pills, well, that's what we're going to do, right? However, type 2 diabetes is a really lousy disease. Like, if you told a cancer patient you can cure your cancer by losing 15 pounds and taking a walk twice a day, oh, people would be losing and walking, right? But with type 2 diabetes, people are like, type 2 diabetes is really a bad disease. So let's talk about the kind of side effects it can have. First of all, we will talk about the side effects of type 1 and type 2 diabetes in our next video.